Hi everyone, and welcome to our chat today on Ayurveda in modern day life. Now, as you know, Ayurveda is an ancient science, and to talk to you about it, we have someone very special today. We have Dr. Deepa Apte, who's a qualified medical doctor, a yoga practitioner, and an Ayurvedic practitioner. She lectures widely on Ayurveda and in yoga. She practices under the name of Ayurveda Pura, Health Spa and Beauty Center. She offers Ayurvedic consultations, yoga sessions, and various workshops. Hello, Dr. Deepa. How are you?
Hello, hi, how are you?
I'm very good. Thank you for joining us on this chat.
No, I'm really glad to be here too.
I've done a quick introduction to you. So tell me, Dr. Deepa, what is wellness to you?
As we all know, wellness is different for different people. For me, when I look at wellness, it is actually a holistic approach. It is all about feeling good and happy in all aspects of life. You know, it has to be physical, emotional, even your energetic wellness, or mind, mental kind of changes, emotions. What Ayurveda says is that, yes, physically you may feel really good, but if in your mind you still have something that is still worrying you, you don't feel good about it, that is not wellness according to Ayurveda. So it's all about feeling good on all aspects of life. And one other really good way of talking about wellness or understanding if a person is, how can I say, enjoying that journey of wellness or not, is when they wake up in the morning. And if you feel happy, if you feel enthusiastic, if you say, yes, you know what, I'm ready for the day, that for me is wellness.
That's magnificent. Now tell me, can you explain to us very quickly about what is Ayurveda and what are the basic principles of Ayurveda?
Yeah. First of all, when we look into Ayurveda, I'm sure everyone knows about it. You know that it is the ancient holistic system from India. And what everyone knows about is it's all about, various body types. So it is Vata, Pitta, and Kapha body types. And putting it in very simple words, what Ayurveda says is that it is our aim to find out what your body type or constitution is. Because based on that, then you are suggesting either what foods or herbs, everyday routine, lifestyle. But the one thing that not many people know is that even when we say Vata, Pitta, Kapha body types, in Ayurveda, we believe that each individual has got two different body types or constitutions. The first one, of course, it's an Ayurvedic term, it's called Prakriti. And Prakriti now literally means Mother Nature. That means it is your basic body type, it is your natural constitution, the one that you're born with. So it's like your DNA imprint, it's your identity. And this is something that will always be with you and it will never change. But the second body type that we have is what we are nowadays, based on all the influences around us. It can be food, travel, work, family around us, weather, all these little things change us as individuals that we are nowadays. And this is called Vikriti, that is today's constitution. And people do sometimes get confused between, what is Prakriti, what is Vikriti? And I usually give this example, that your Prakriti, your basic body type, is like a solid hard surface. It can be made of wooden or steel, glass, it's solid, it's stable. And your Vikriti, or today's constitution, is like a layer of dust on this solid hard surface. And you will see that even at home, when there's a layer of dust formed on any furniture, we're always wiping it away. And that is what Ayurveda also says. Aim is to find out what your basic body type is, what your today's constitution is, and then to apply the 5 various approaches to help wipe away that layer of dust so that you go back to being your original constitution.
So basically you're saying we're working with nature versus nurture. And nature
Yes.
is Prakriti and nurture is Vikriti.
Nurture is not directly Vikriti, but it's the environment changes around us. Because even when we say nurture, from outside, those nurturing qualities can be nourishing qualities or not. It can be either or. So we are understanding what those elements are. But yes, in principle, that is what it is.
Okay, so Dr. Deepa, when a patient comes to you with an issue and or a problem, can you tell us the process you go through as an Ayurvedic doctor and a medical doctor? Ayurvedic practitioner and a medical doctor.
Yeah, medical doctor. The way I do things at the moment, of course, I don't directly apply modern medical practices into my practice. But yes, I'm very fortunate that I come from that medical background, gastroenterology, and that really helps me to understand an individual's, imbalances, illnesses, and everything. But then in principle, when someone were to come to me, the aim, first of all, is to find out the reason for why they are there. So in Ayurveda, we always say, or remember my mom always telling me this proverb, that find out the answer for why, the how, what, when, where will automatically fall in place. So when someone comes to me for a consultation, then I understand their why first, because then that makes it easy to understand, what approaches are to be applied. But then again, when you're looking into the whole Ayurvedic side of a consultation, it's amazing because it is very similar to a modern medical practice. In modern medicine, as a GP or consultant, we have always applied 4 different ways in any consultation. And that is what today's doctors should be doing. The first one is history taking, so we ask questions. The second one is observation, so we are observing the client. Third one is palpation, meaning it is all to do with touch. And fourth, we say auscultation. So in today's day and age, we're using the stethoscope to hear any sounds. But amazingly, all these 4 actually come from Ayurveda. Because in Ayurveda, we always start off by asking questions first, because we need to know what the client is thinking about. Then as we're asking questions, we're observing too, and I'm doing exactly that. Now, when we say palpation, then we are doing what is called as pulse diagnosis. Mm-hmm. Or when I say observation, I'm looking at the tongue for tongue diagnosis. And then when I say auscultation, the same thing. We are hearing sounds. It can be sound of the voice or sounds in the body. So that is exactly what is done. So in principle, a consultation contains everything, asking questions, observing, pulse diagnosis, tongue diagnosis, and based on all the information that I get, then I will put a plan across, and then this plan can be a combination of all the 5 approaches of Ayurveda, and these can be foods or herbs or manual therapies, massages, or yoga lifestyle, or yoga, like everyday yoga practice, or daily lifestyle or routine. So all of these are applied as a therapy plan.
When I've gone to Veds in India, and some amazing ones, their knowledge, their knowledge is absolutely magnificent. But I found that the regime quite difficult to do, because every hour they've given me something has to be mixed in X, something has to be mixed in Y, and it's been like a full-time job just to stick to that regimen. And I found that very difficult living in London. How do you adjust that for modern day life?
First of all, it has not been written anywhere in Ayurveda that you have to take herbs every hour. Mm-hmm. What Ayurveda actually says, this is the actual true principle of Ayurveda, even though it's very ancient. Mm-hmm. I do get a lot of clients, even before they sit in the chair, when I'm doing a consultation, they tell me, please don't ask me to change my food habits. Please don't ask me to eat khichdi every day. Please don't ask me to become vegetarian. And I tell them all, I don't know where you've heard all of this, but this is not what Ayurveda is. Ayurveda is not about changing your whole life, to fit Ayurveda in there, but it's literally the other way around. It's all about integrating Ayurvedic principles into your everyday life. That bit is important. And hence, from that point of view, you will see that, again, Ayurveda is so amazing. We've got all those 5 approaches, We've got foods, we've got herbs, we've got massages, yoga, everyday lifestyle, and routine. When you actually look into all those 5 approaches, you will see that it is holistic. Mm-hmm. It integrates every part of your everyday routine lifestyle. Everything is in there. And when I get clients saying, I travel a lot, and I understand, that probably they may not be able to do much with foods. And I'll say, okay, fine. These are the herbs, have them 3 times a day after your breakfast, lunch, dinner. It is possible. I do get a lot of clients saying, at the moment for me to do yoga may not be possible because my lifestyle is so busy. Mm-hmm. Then I will tell them, okay, fine, do such bits in terms of foods or herbs, or come to the clinic maybe once every 2 weeks for a massage. So it's all about understanding as to how you integrate all these elements into your everyday routine. Having said that, yes, if someone were to have a bit more severe imbalance illness, then we are prioritizing, It's not just about, how easy it is. Then the aim is to get rid of that illness and disease. So then, yes, I do get clients who may be suffering from end stage like liver failure, renal failure, cancers, whatever. Then I tell them, are you ready to put 2 months aside, more committed, just 2-3 months, so that you start seeing the change. And after that, we can start easing off the plan. So it's all about understanding the client's needs and wants, and then integrating things accordingly.
Okay. And can you give us some tools and techniques for a healthy lifestyle? Like you're saying, if you get, say, an averagely healthy client, can you give them tools and techniques to stay that way?
Yeah. First of all, in Ayurveda, we always say that there are two aspects of our life, or rather three, but on a daily basis, it's two. It is our body and it is our mind. And you'll see that the body and mind are always having a conversation with each other. The best example I can give is, I've worked all day, I'm really tired. My body's saying, you know what, Deepa, you're really tired, you need to sleep. But then the mind comes along saying, no, you have to send that email, you have to make that phone call, you have to finish writing that article. The body's like, no, but I'm really exhausted. So it's all about that communication between mind and body. And Ayurveda does always say, listen to your bodies, just see what messages the body is giving out and act accordingly. So there's the first thing, very simple rules, rather than saying, I know many people out there will say, oh yes, drink hot water in the morning, have your turmeric milk in the afternoon. We've heard of all of this everywhere, but I'm giving more general suggestions so that it becomes easy, especially in today's modern day life, to follow it. The second important thing, what Ayurveda says, is all about understanding nature around you. Literally nature in terms of, is it hot, is it cold, is it winter, is it spring, and then follow a lifestyle accordingly. But another very important environment, or nature if you want to call it, people don't really understand, is your artificial environment. Yes, when it is cold out there, I will wear something warm. If it is hot out there, I'll wear something cooling. But what is happening literally with people around you, emotions around you, and also working with those. So if you think that someone is a bit more irritable, angry, don't take that in thinking it is, sometimes we need to distance, take a step back, observe and react accordingly. So first is listening to the body. Second, important is listening to nature. But one or two, three things, this is, as we say, a healthy man's regime. What Ayurveda also says is that three important bits is to eat only when you are hungry. That is very important. I know everyone says, oh, you have to have breakfast, you have to have lunch, you have to have dinner. But it is all about regulating it, but eating only when you are hungry. That is important. Ayurveda also says, do not eat food when you are emotionally distressed, angry or irritable, frustrated, because under such times, you will end up eating too much or too little. That means your digestive fire will go out of balance and may lead to illnesses and diseases. Under such times, when you are going through any kind of emotional changes, Ayurveda says drink plenty of warm water, herbal teas, because that is how you regulate your digestive fire. Another very important thing is all about eliminations, meaning what Ayurveda says is, forget your body type, forget if you're Vata, Pitta, Kapha, Dosha, forget your Agni, Ojas, Tejas, we've got all these terms. Put all of that aside. On a daily basis, make sure that your stool elimination is regular, your sweat elimination is regular, and your urine elimination is regular. Meaning, we need to sweat some amount every day. We need to pass enough urine every day, but very, very important is no constipation. In Ayurveda, we believe that 80 to 90% of all illnesses and diseases start with constipation. So in that way, you're listening to your body too. And hence, making sure that stool elimination is regular every day. So that is also another thing to follow. And one last thing is sleep. I know we all talk about it and people sometimes don't understand why sleep is so important. What Ayurveda says, that first of all, it is only when we sleep our tissues are healing. Whatever that may have gone out of balance, any tissue injury, it is only when we sleep the tissues and the organs heal. Then I do get clients saying, you know what, I go to sleep 1 a.m. at night, but I sleep 8 hours. I sleep 8 hours, but I go to sleep only at 1 or 2 in the morning. And then I explain to them, it's not about what time, how many hours you sleep. What time you go to sleep is also so important, because according to Ayurveda, around 10:30, we say, Pitta time or liver time begins. That means when all these Pitta organs are kind of a bit active in the body, we need to be sleeping. Because if we are awake, it is being awake, heat, fire. At the same time, the liver or such organs are also trying to work. That means there are two fires becoming too active. And when that happens, that then may result in reduced lifespan.
Okay. So
loads of suggestions.
That's a lot. And thank you for that. That's very, very useful. You said, to summarize it, you said, listen to your body, listen to nature, eat when hungry, eat when calm, And
Yes.
elimination is very important, and sleep is very important. Those five, just to put all your wonderful knowledge into a quick nutshell. Thank you. Tell me, Dr. Deepa, with all your experience, you must have seen some incredible cures through Ayurveda, people coming back to balance. And so can you give us the example of some that you've done or seen otherwise, which, people thought you couldn't help them, and you managed to help them?
Then, I've got this little wooden table in front of me. I'm going to touch this wood, as we say, touch wood. I've been very fortunate for all the 18, 19, 20 years that I've been practicing here in UK. I would say, except for 5, 6 clients who have come back saying that hasn't worked at all, everyone has come back saying, you know what, Ayurveda has really helped. And people do ask me, what about those 5, 6 clients? What went wrong? What was it? These were the people probably who were not ready for Ayurveda at that time, or they didn't believe in it, so other aspects also. But a few specific examples are medical conditions where I've had clients with really deteriorating vision, due to some other medical causes and conditions. They had to go through surgical kind of, procedures. And because of that, even though the doctors tried, they were losing vision. And just through Ayurvedic practice or, ways, vision was restored. So that's one thing. I've had many clients, again, touch wood, I've been very fortunate, whereby people have given feedback in terms of, thyroid conditions or fibroid conditions, ovarian cysts, or even things like fertility issues. And I have so many clients who've been trying to get pregnant, did not get pregnant, and now they're all happy, not just pregnant, but with children. So there are many such examples that I can give, but these are the ones that come to my mind ASAP.
Okay. Wow. Tell me, what a lot of people say is that when we go to a holistic therapist, it takes longer. When we go to a medical doctor, we pop a pill. Now, of course, it's very different, but typically if someone comes to you with an issue, how long would you tell them to try it before they can say whether it's working, beginning to work, not working?
Yeah, sure. See, again, over there, Ayurveda is very clever, and I've got a big smile on my face, because that is how, just not clever, but progress and advanced Ayurveda is. Probably people listening, they may know of it, but in Ayurveda, we've got the whole what is called as tissue system. Dhatus is the term that we use. And there are 7 primary tissues. But the amazing bit is the way these 7 tissues are formed, they're formed one after the other. And then just to make it easy, so that people will understand, the first tissue is plasma, which takes approximately 6 days to be formed once we've eaten food. Then after plasma comes blood tissue, which takes another 6 days. So, and I'll just give the example of the third one, which is muscle tissue, which is again, another 6 days. That means whatever that I eat or drink today, it will take approximately 18 days for that food that I've eaten today to be converted into healthy muscle tissue. But interestingly, the same principle is followed when you're looking to correct illnesses and diseases. So I do get clients who may be coming with arthritis or reproductive tissues, reproductive problems. And I tell them that they have to wait at least 40 days before they see any changes, because that is how tissue conversion works. Someone who may come with skin conditions, plasma-related problems, low blood pressure, circulatory problems, I might tell them, within the next 7 days, you might start seeing changes. So it is, again, very cleverly put in Ayurveda that based on the presentation, the time period that they may see an improvement with will also change.
Okay, and how people, if someone is following another regime, so whether it's medical, like chemotherapy, or whether someone's doing something like homeopathy, would you then recommend that they can still come and do Ayurveda?
Yeah. Yes. Again, that is another beauty of Ayurveda, that it is very compatible with many other treatment modalities, especially nowadays. I understand that a lot of people do take allopathic medication. So I get a lot of clients who may be on chemotherapy, radiotherapy, or they may be on blood thinners, cardiovascular problems. I will never, ever ask them to stop that medication. Because interestingly, in India, when I was first studying, but then working, my teachers actually taught me to integrate allopathy with Ayurveda. And I was so used to that kind of practice. But when I moved here, first Germany and over here, it took a bit of time in my head to adjust that, no, Deepa, you know what? Over here, they treat it as 2 very different systems. But amazingly, if you were to combine allopathy and Ayurveda or any other modalities, you will see much better and faster results.
Okay. Oh, wow. I'm completely blown away by our chat today. And this is what, I've been into Ayurveda since I was a child, but this has been so informative. Before we go on to audience questions, do you have any last advice for our people listening in?
A few things that I will say is, I remember growing up, my mom, who was my most important teacher, and then my Ayurvedic professors, they've always said, no matter what, enjoy life, because every moment going by will never come back. And because of that, of course, on one hand, we need to be a bit cautious of what we do, but that does not mean that you get so kind of, like bound down to all these rituals and practices where you actually forget to enjoy life. So it's all about finding that fine balance. So yes, I do get clients who may be saying, I want to lose weight, but once every 2 weeks, I might go to see my friends and I might have a glass of wine. Should I stop that? I say, no, you know what? You live life only once. So enjoy that bit too. Because once the mind is also satisfied, the body will also follow. So there is, that kind of connection. So I would say, yes, go ahead, enjoy life, every moment that comes by, because it will never come back.
That's lovely advice. So now moving on to questions. Someone's asking, what should we eat for breakfast, lunch, and dinner as per Ayurveda?
See, a first rule to be followed in Ayurveda is that we never eat anything cold. So be it breakfast, lunch, dinner, it is usually warm. So definitely for breakfast, no cold yogurts, no cold milk. Classically, we would say something warm to eat. Porridge is good, with a bit of cinnamon. You can put a bit of chyawanprash in your porridge. So something warm. That is the first thing. So when it comes to lunch and dinner, again, in Ayurveda, once again, we will say, understand what your body type or constitution is, but even more important than that is weather. Understand what the kind of weather is outside and follow your food habits accordingly. But because we are talking about foods, in Ayurveda, there are a few rules to be followed. We in Ayurveda say that you always eat fruit alone or you leave it alone. We never mix fruits with anything. Someone has asked if that, can we have breakfast fruits for breakfast? We never combine fruits with anything. We either eat it alone or we leave it alone. This time when I say leave it alone, we don't stew fruits. We don't cook fruits. We will not mix it with any other grains, any other vegetables, any other meat. Yes, you can mix some nuts with fruits and you can have it, but never to cook it, ever. And yes, if someone wants to have fruits for breakfast, yes, they can, but bear in mind, fruits as they are, never to cook them, stew them, bake them, roast them, never.
Okay, wonderful. The herbs that you recommend, like the triplas, or can you do it as a lifestyle or do you have to give it a break?
No, amazingly, all the Ayurvedic herbs are such where you can take it long-term too if you want to. But of course, if you're taking long-term, you're not taking loads every day. It might just be 1 or 2 capsules, on a regular daily basis. In fact, talking about tripla, it's a very interesting fact. I'm sure you know of garam masala, the one that we put in cooking. I know when we talk about garam masala, we talk about, like cinnamon powder or ginger powder, whatever. But the actual very, very ancient recipe of garam masala would have had approximately 20 or 30% of tripla powder in it.
Ooh,
that means, we're actually using it in cooking. So if someone wants, if they have got their own home masalas, just not garam masala, just add 20% of tripla powder to it and it goes into the cooking. So do bear in mind, in English, we are calling them herbs, but when we look into the word tripla, 3 is 3 and phala is fruits. So if we can have all other fruits every day, why can't we have these 3 fruits on a daily basis?
Oh, wow. I just don't know what to say. I had no idea that garam masala had tripla in it.
The ancient one. It's changed now,
wow,
but we actually added tripla to it.
And then there is another question which came up today, which is probably, there is so many people who ask this question. Can Ayurveda help with weight loss?
Absolutely. Very much so. In fact, talking of which, I actually run Ayurveda and Yoga for weight loss programs. And I've had clients also who followed it. And they have seen over 4 weeks, people have lost 5 to 6 kilograms, 9 kilograms. It is very much possible. But to understand that, like any other plan or protocol, commitment is needed. Now, when I say commitment, When I run my weight loss programs, it's not about that you're starving. In fact, I tell all my clients, my students, that you need to enjoy life, you need to enjoy food. But it is all about how you are becoming clever with food. That bit is important. And yes, Ayurveda can definitely help with weight loss.
Okay. And there's one other question that's come up for me here. Someone's asking that, you know how you're talking about trifla and you're talking about our Indian cooking and the Indian herbs we use in the cooking. What if the likes of the gingers and the turmerics don't suit someone? Because those are something which is there, which is prevalent a lot in Ayurveda.
See, again, in Ayurveda, it is not that you have to have all of it or none of it. Ayurveda says based on your body type, your constitution, or even in terms of your tolerance. Yes, you can choose what you want to eat. I understand, understandably so, that, turmeric may not suit everyone because of the constitution, or ginger may not suit everyone because of the constitution. And hence, understanding what the imbalance is going on or what the changes are happening, and accordingly, foods are also suggested. So just because someone does not have turmeric, I would never say, oh, they are not following Ayurveda. Because let's be honest, as the word goes, Ayu is life, Veda is science. And what Ayurveda says is that Ayurveda exists everywhere, wherever there is life. Thousands of years ago, out here in the UK, people lived, but they never had turmeric. Yet they were living an Ayurvedic life because you are reacting to nature. Ayurveda is also that science where all your everyday reactions and responses which are natural, which are in line with nature, is also Ayurveda. So it's not about specifically what you're following or not. It is all about where you live, Desha, your local geography, and to follow things accordingly.
Can Ayurveda help with menopause?
Absolutely, yes. And one thing also to bear in mind, according to Ayurveda, menopause is not an imbalance or illness, it is a transition of life. A lot of times, women are waiting for menopause to happen the moment they are 40, 41, 42. I must be honest, I'm 48 now. I'm not expecting menopause for at least 5-6 years. I get my periods regularly because it is all in your mind too. It's the mindset, your attitude. But if someone is going through any kind of transitional changes like, hot flushes or osteoporosis, there are many suggestions that can be talked about in Ayurveda. So yes, it can help, or it does help.
And anything you can recommend to people to prepare for it, to prepare for menopause?
Whenever a preparation for towards menopause, bear in mind, when menopause is happening or approaching, the body is going dry. So it is all about nourishing the body. So plenty of hot oil massages or oil pulling, or having tiny, like maybe half a teaspoonful of ghee or oil on a daily basis. That is one thing. Second important thing is, once again, to make sure that there is no constipation, because when there is constipation, it makes the whole menopausal transition even worse. Then as they are approaching, or one other way of preparing is one particular herb called Shatavari. And that is really good for menopause too. But again, for that, I would tell everyone who's listening, there are a few things to bear in mind in terms of, any other accompanying illnesses, conditions. So if you're looking to take Shatavari, please consult an Ayurvedic practitioner so that they can tell you how to take it. So these are 2-3 things that can be done as an everyday, lifestyle routine for menopause too.
Okay, that's wonderful. I'm sure you're going to get lots of calls. But thank you so much for the wonderful information. This was Dr. Deepa Apte, and we talked about Ayurveda in modern life. This is Anshu Bahanda at Wellness Curated. Thank you for being here with us today.